Gurjit here from SuentaHealth. Today I want to talk to you about physical pain management and releasing. Now we've talked much about emotional through meditations and calming and relaxing. So today I'm going to just focus on physical pain. Now it has been said that 75% of physical pain is emotional. And what that means is it's the part of us that wants to fight that pain, struggle against it and resist it. That's the emotional aspect of it. The pain is a pain and it's going to hurt. But what we can do to help our body and help ourselves is not fight it, accept it. And remember, accepting something doesn't mean you like it or condone it. It just means you're going to release the resistance to it. Now, some of you may be thinking of some pretty serious pains from surgery or other injuries, and this will work in those areas as well. Now, we're not taking away the pain here. We're reducing it. Now, for some of you, as you practice with this, you will be able to make the pain go away. So if you have a headache, for example, or a little bit of a pain in a muscle, it can be released in this way. But any other serious pain, it will reduce it, and that's what we want to look for. Now, we don't even need to do this in a meditation, but it is to get you to a point of being calm and relaxed. So we'll always start it with the breath work and bringing our focus into our bodies and into ourselves. Now, the best way to practice with this is to do the meditation techniques that I've talked about in past videos, with the breath work, grounding, using the bubble for some safety. And if you want to do this in the heart space, it can be done in the heart space also. Now, what I'd like you to do is think about a pain that you may be having at this time. And if you don't feel any pain in your body at this time, maybe think back to a time when you had a headache or a neck pain or a joint pain or some kind of pain in your physical body. And what we're going to do is we'll bring that forward and have you practice with that. Now, what I'd like you to do is first of all gauge the level of that pain on a scale from 0 to 10. 0 being no pain, 10 being excruciating pain. So for example, if you have a headache on the left side of your head, for example, and it's at a 7 out of 10, when you work through this technique, it will bring it down. Again, it may not release it fully, but it will bring that pain level down. And even if it comes down to a 6 or a 5, that is still a release and a relief for your body so that you can think more clearly and focus. So now think of a pain, if you have one right now, again, we'll use that, or one that you had recently. And I'd like you to close your eyes or lower your gaze to an area in front of you on the floor. Just take some nice deep breaths, keeping your shoulders and your chest still, breathing from your stomach or your diaphragm. Now, if those are the areas of pain, do what you can, but just slow down the breath and keep your focus only on the breath. As you're focusing on your breath, bring yourself back to a regular rhythm of breathing. Any thoughts or distractions that come up, just bring your focus back to your breath. Now, what I'd like you to do is I'd like you to imagine that you are standing outside of your body and you're facing the area where the physical pain is. So for example, if it's in your head, imagine you're standing facing that part of your head. If it's in your back, imagine you're standing and facing your back. And I want you to imagine there's a door in that area. Now, when you open that door, you are going to be facing that physical pain. So go ahead and open that door and look inside to see that pain. And what I want you to do is give it like an identity. Look at it, a color, as a shape. It could be spiky, it could be smooth. Describe it to yourself. You can almost imagine putting your hand through that doorway into the pain. Feel the texture. Is it cold? Is it warm? Describe it with as many words as you can possibly describe it. Now what I'd like you to do is I'd like you to imagine you're using both your hands and And you're going to put your hands around that pain and mold it into like a circle or a shape that's easy for you to hold. Good, there we go. And now, I want you to take that pain, whatever color or shape it is now, and I want you to pull it out of your body. There we go. Feel every sensation in your body. Do not think. The moment you think, you're in your mind and you're analyzing. Bring yourself back into the body and into that area. And as you pull it out of your body, let it go up and ask the universe to take it away. Now you may take a deep breath, which will be an indication of the releasing, or you may feel a shift of energies. And now what I'd like you to do is look inside that door where that pain was. Just make sure there's no remnants of it left. And you notice this if there's any bits of the color that you had seen. If there is, just do the same thing. Bring it together, pull it out, and let it go and ask the universe to take it. When it's all gone, I want you to ask the universe to send down whatever energy is in your highest and best interest at this time into that area, and feel that change and shift of energy taking place. Good. Now be aware of your body. If it just takes deep breaths by itself, it means the releasing is happening. You may not feel that breath, but you may just feel a shift of energies. There's no right or wrong way to do this. And when you're ready, close the door, bring yourself back into your body, feel your grounding to the earth, take a deep breath, and open your eyes and bring yourself back into your room. Now, I'd like you to use that scale again from 0 to 10 and see where that pain level is. Now remember, this may be a pain that you've just worked on that you had, or one that you imagined from the past. And you should have noticed a decrease, even if it's just by 1 or 2 numbers or quite a lot. There will be a difference. This is just one technique. There are many others that can be used as well. Faster ones also. But once you practice, you will make this technique your own. Because once you know how to work with the energies and the sensations and the feelings, not the mind, but the body, then you'll know you can work with it and play with it in your own way. Thank you for your time. I hope this helped with some pain release that you had. If you have any questions, please feel free to contact me through my website at www.SuentaHealth.com. And I look forward to working with you again in the future.